This client here is about to receive a chemical peel and a microneedling treatment. So here you can see the practitioner is offering the client a pre-cleanse. It's very important to double cleanse to ensure that any SPFs, any dirt, any bacteria is removed from the skin before applying the chemical peel. When offering a chemical peel and a microneedling treatment together, it's very important that the chemical peel treatment takes place first. This is due to the microneedling treatment being more abrasive. Microneedling treatment will actually create tiny little incisions into the skin, and we don't want the chemical peel to enter the dermis. You can use a cleanser of your choice. In this particular occasion, we are using a brand called Clinicare. The chemical peel brand that we're about to use is Bio Repeel. A Bio Repeel is a 35% peel, which means it does stimulate the upper dermis. However, we don't want to stimulate the upper dermis with a chemical peel after microneedling, which, as mentioned just before, we will be applying and administering the chemical peel. So the product has already been drawn up from the bung into the syringe. And as you can see, the practitioner is applying the peel gently over the full surface of the skin, and the needle has been removed from the syringe. Do be very, very careful not to press too hard on the syringe. It's not likely that this product will squirt out because it is quite thick. So on this particular occasion, this is a well-known client, and this client has received this treatment various times. So we did take out the need to apply any kind of gel, any kind of barrier cream around the eyes and the nose, because we know that the client will keep still. We're also very familiar with the product, so we know that the product will not run into the client's eyes or nose or mouth. So as you can see, the product is resting on the surface of the skin. It hasn't been rubbed in, it's just been applied to the surface. Never leave your client alone when this product is in, because it can offer a tingling sensation. This particular product, Bio Repeel, stops processing once the optimal stage has been reached. This particular client, obviously we've cut, but the client has had the product left on their skin for 4 minutes. As you can see, they haven't experienced any discomfort, there hasn't been any excessive redness to the skin. As mentioned earlier, never leave the client on their own. They may experience some discomfort, which could lead to panicking, and it could lead to them potentially rubbing their face, which could lead to rubbing the product into the eyes, nose or mouth, which could be quite dangerous. Before we move on to the microneedling treatment, there are a few other points to discuss. As you can see from the previous demo, there is very little skill to the administration of chemical peel. Where the skill becomes a skill is really down to product knowledge, understanding the different ingredients, understanding whether the client is likely to have some sort of contra action, and ensuring that you carry out the consultation, carry out the consent to make sure that there are no contraindications, and therefore a contra-action is not likely to take place. Some people like to apply it perhaps with a different tool, perhaps a sterile brush or any other tool that you may find useful. So we're just about to move on to the microneedling treatment. Hopefully you will have watched the previous video that shows how to withdraw the Bio Repeel from a sterile bung. It works exactly the same with microneedling products. There are an abundance of microneedling products out there, different serums, and there are a variety of different brands that you may want to choose from. Different serums have different viscosities and velocities, so it's always wise to opt for a 3 or 5 ml syringe, which allows you to hold quite a lot of product, obviously up to 3 or 5 mils, but also you want to be looking at roughly a 21 gauge needle to make sure that it can extract thick products, and also look at quite a long needle, perhaps a 32mm long needle, just to ensure that you don't get caught out when trying to withdraw the product. On this particular occasion, we have used a Derma 2.0 product, and we've used the Exosomes product for this particular client. This particular client has received lots of different treatments and has offered feedback with regards to the Bio Repeal and the Derma 2.0 Exosomes, offering the results that they are happy with. So as you can see, the practitioner is stretching the skin. I do understand that there is a hand that is placed in the way of the needle, but we have applied a 36 pin needle to the microneedling pen, and as you can see, there is tattoo tape covering up the pen to ensure that cross-contamination doesn't take place. The pen has been set at 1 mil, which means that the pins from the needle, from the cartridge, will go into the skin at 1mm depth. The speed of the machine is down to yourself, whichever you feel comfortable with. I would recommend setting it at a speed of 2 to 3. Not all microneedling pens offer a different speed, but they should all offer different depths. So as you can see, we are working in a circular motion here. And the practitioner isn't going too fast. It's in a nice controlled. I wouldn't go any faster than this. This is probably the speediest you would go with a microneedling pen. And as you can see, the client isn't experiencing redness. There does seem to be some myths out there that a client's face needs to draw blood. This myth may be attached to the vampire facial treatment, which is a very popular treatment. It involves microneedling the client's own platelet-rich plasma, and in many cases what happens on social media is you will see staged images or videos where blood has been attached to the skin. This is not necessary. A client's skin does not need to bleed. It doesn't need to be excessively red for this treatment to work. When you are applying the serums, apply small amounts, because what you don't want to do is you don't want the serum to soak into the skin before you microneedle it in. So if you watch the practitioner is very careful not to press on the syringe too quickly. Depending on the quality and the viscosity of the serum, it could be that the serum could squirt out too quickly and could land in a client's eyes or mouth or nose, causing discomfort. So again, the practitioner is working in nice circular motions, not applying too much pressure on the client's skin, but it is possible to apply more pressure where there is more skin. So as we enter perhaps the jawline, where we are quite clear that there is a bone present, or near the cheekbones, we would ease off the pressure just to ensure client comfort. So you work on a grid system along the skin, making sure that you cover every single part of the face. As mentioned earlier in the training course, it's not only the face that can be treated with microneedling, it can be treated anywhere in the body. This particular client is just looking for an overall improvement. They haven't entered the clinic asking for us to fix a problem such as acne, scarring, rosacea, or hyperpigmentation, this treatment that you see in this video is for overall improvement. Certain skin issues or conditions or skin problems such as hyperpigmentation, scarring and acne, they can be treated. With microneedling, they would need bespoke serums that are suited to that particular problem, and you would alter the depth of the needle according to the problem. As an example, for scarring, you would need to go a little bit deeper than 1 mil. So please refer to the charts that are displayed in different chapters of this training course. Keep going back and reading them, and keep coming back and looking at the video. As you can see, the client isn't experiencing any discomfort from this. Some people may wish to apply numbing cream prior to a treatment. I personally feel it's not necessary if you are setting the pen to a 1 mil depth. It may be that under the eyes you might want to apply a little bit of numbing cream, again just for the client's comfort. As you do move to the under eye and the forehead, you will need to turn the depth of the pen down to 0.5, so that's half a millimeter. On the forehead there isn't as much skin as there is around the rest of the face, therefore by applying the microneedling at a 1 mil depth could cause discomfort and even possibly scarring to the client if you were to apply it at a 1 mil depth. As you can see, the practitioner is stretching the skin in certain areas. This is to ensure that the client isn't scarred from the microneedling. If you have a client that has either excess skin or excess fat in the area that you are working in, it's very important that you stretch that skin. If you were to microneedling skin that has gathered together, not only will you miss part of the skin out, but what you would also do is cause discomfort and possibly long-term scarring to the skin. This particular client does have very tight skin and doesn't have any excess fat or excess skin. Therefore, stretching is less necessary than it would be with somebody with that excess skin or excess fat, as mentioned. As you can see, we're working on the forehead now, and the Dr. pen, the microneedling pen, has been set to 0.5. What that means is that the pins will enter the skin in half a millimeter as opposed to a full millimeter. It's important that the pen is turned down from 1 mil to half a mil due to the lack of excess skin on the forehead. It is very close to the bone, and therefore it could cause discomfort and scarring if the pen was set too high. It's not unusual to begin to see the client's skin go a little bit pinker or a little bit redder just a few minutes after contact has been made with the cartridge. It doesn't always go red straight away, and it's important to leave that time to observe the change in the client's skin before applying any more pressure or any more depth or covering the area an extra time. You can apply serums after contact has been made with the cartridge. So after the skin has been pierced, you can apply more serums. As long as these serums have been withdrawn from a sterile vial, they will be safe to apply to the client's skin. It could be that you want to use different products that offer different benefits throughout the face. So it could be that you might want to use an under eye product under the eye. It could be that you want to use perhaps an anti-aging or an exosome product over the whole of the face, but it might be also that you want to target specific areas with perhaps a whitening serum. That would be to eliminate such things as hyperpigmentation. This particular client doesn't have any hyperpigmentation, microneedling over the eyebrows can stimulate hair growth. It could be that clients actually specifically want to have their eyebrows treated, and you would use a scalp type serum which would stimulate hair growth. You may have heard of a product or a treatment or a training course named brow vitamins. What brow vitamin training or treatment is microneedling the eyebrows. It's not unusual that a client may need to sneeze when receiving treatments near the eyebrows. It is quite common. So as you can see, there is a little bit of blood on the surface of the skin there. It doesn't appear that any damage has been caused, and this can quite easily happen. There might just be certain areas of the skin where there is a larger buildup of capillaries. So slight bleeding like that is absolutely nothing to worry about, but it isn't something that we should be endeavouring to create. And here we have a chemical peel and microneedling treatment fully completed. Thank you for watching.